to advise the temporary suspension of the Johnson & Johnson rollout in the US. This has occurred due to reports of 6 females who developed unusual blood clots with low platelets. These incidents occurred between 6 and 13 days after the vaccination in women between the ages of 18 to 48 years old. It must be noted that over 6.6 million citizens have been inoculated with Johnson & Johnson vaccines in the US. In South Africa, we have not had any reports of clots that have formed after the vaccination, and this is after having vaccinated about 289,000 healthcare workers under the Sisonke protocol. Having said that, after this advisory came to my attention, I held urgent consultations with our scientists who have advised that we cannot take the decision made by the FDA lightly. Based on their advice, we have determined to voluntarily suspend our rollout until the causal relationship between the development of clots and the Johnson & Johnson vaccine is sufficiently interrogated. SAPRA will collate information from Johnson & Johnson, the FDA, and other regulatory bodies to make a thorough assessment of the situation and advise us as a regulatory body that has exercised its authoritative powers on the approval of the vaccine in their own right. I humbly call for calm and patience as we ensure that we continue to be properly guided by science in ensuring the safety of our people as we roll out the vaccine campaign. We hope that the deliberations will only take a few days. Given the preliminary literature on hand, our scientists are confident that the FDA decision is only a precautionary basis, and we expect that this will not result in the complete withdrawal of the Johnson & Johnson vaccine from the vaccination armament. We also wish to assure citizens that these kinds of reports are expected to emerge as part of a robust post-market surveillance system, and this should provide comfort that medical authorities keep a vigilant watch on a new product that is deployed into the market to ensure they remain safe and effective for human consumption. It is for this reason that we implemented the Sisonke protocol and will also implement a similar post-market surveillance study for Pfizer when we roll out the first batch of doses to healthcare workers. I'm also glad to say, however, that there are good news in the midst of all this development. I'm happy to announce that we have also successfully negotiated another, that is additional 10 million doses from Pfizer. Of these, we expect just under 2 million to be delivered early in May. This therefore means that we have secured 30 million doses of the Pfizer vaccine for this financial year. This also assures us in the extremely unlikely event that Johnson & Johnson rollout is completely halted, we will not have any impediment to proceed with phase 2 of our rollout with Pfizer. We don't, however, anticipate that Johnson & Johnson will be halted permanently. We believe it's a matter that will be cleared in a matter of days. We are confident that our rollout of Johnson & Johnson will resume, and so with the 30 million doses of Johnson & Johnson, as well as the 30 million from Pfizer secured, we now have enough doses to exceed the 40 million target we had set for the year. This is in line with our commitment to vaccinate as many people as possible in this financial year. In the ideal scenario, we would have vaccinated every single adult found in South Africa. So at this point, we must say that we've got enough doses to be able to reach all those who will be needing to be vaccinated. This development is an example of how we as government make commitments and work to the best of our ability to honor those commitments. However, science must be respected at all times, and that this sometimes means a disruption in our plans. Although we're operating in a dynamic and ever-changing environment, the government is constantly seeking to secure vaccines that will protect us from the 501Y.V2 variant. We therefore urge South Africans to be supportive of our experts and scientists as they work under enormous pressure to give us answers on this worrying development so that they may proceed safely with the global vaccination program, and we commit to keep the public informed of all these developments. Tonight, the regulator, SAPRA, will have their first meeting in this regard, and tomorrow morning, the Vaccine Ministerial Advisory Committee will also be meeting. So we will be, well informed in a matter of, today and tonight and tomorrow about what progress is taking place in this regard. We're also in contact with the Africa Center for Disease Control. We're also in contact with the WHO, who have offered to give us advice at any one time so that we are able to be guided by all the views that are coming from this kind of situation, being a new situation. With that, I just want to say thank you, and we will obviously be back to give as much information about it in the next coming days. Thank you very much.
Well, thank you very much, Minister. Much appreciated, and we're glad that there is at least a sliver of hope, silver lining in this cloud of the additional 10 million doses that are coming from Pfizer. So now I'm going to invite, and I hope this works out, I'm going to invite SABC, and let's just see if they can, if they'll be able to come through live and ask their questions. Francis Heard, are you able to come through and ask your question?
Yes, can you hear me? Are you able to hear me?
Francis?
Yes, can you hear me?
Okay, let's see if we can get Newsroom Africa, if Kathy Mkhize can maybe come through. All right, we'll see if Sally Burdett can come through from ENC and Minister, and I'm going to also ask, okay, I see SABC has unmuted. Francis?
Are you able to hear me?
Yes, we can hear you. Thank you very much.
Okay, great. And thank you, Minister. I guess a very quick question. Is this not a knee-jerk reaction? We're talking about 6 people after 6 million or so have been vaccinated, I think you said. Could we not wait a little bit longer? I mean, the Johnson & Johnson vaccines are only arriving en masse, as I understand, towards the end of this month.
Thank you, Francis. Minister? Francis, thank you very much for your question. I'm not sure if Minister perhaps is having a challenge with connectivity, but I see that...
I'm sorry, can I request that let's repeat the question? I missed out the question. There was a bit of a...
Yes, Francis, please come through again.
Sure. Minister, my question simply is, are we not responding in a knee-jerk fashion? Quickly following the FDA, you said that the World Health Organization still has to give advice, and the numbers are very low. I think 6 people out of 6 million vaccinated. So are we not jumping the gun, making a knee-jerk decision here?
Not at all. What we have done quite a quick consultation amongst our advisory teams. We have discussed with the Medical Research Council. We have discussed with the ethics committees that have overseen the Sisonke protocol study. We have also discussed with the Ministerial Advisory Committee currently. Professors Kollega Mdisana and that committee, and also we are also consulting with SAPRA. The feeling has been that because this announcement has come from the FDA, and we would need to collate as much information, we think that it's a precautionary halting. So it's not we're closing down on the Johnson & Johnson. As soon as the information is made available, we're quite certain that we should be able to move on. But when there's concerns that have been raised, we believe it's important to take them seriously. And so in the current consultation that we've gone through, we have seen that this is what we need to do. It might take a couple of days to resume, but at this point, we think it might be the best way to deal with it. We are also linking up with Johnson & Johnson to see what their advices are going to be. We're aware that a lot of discussion is going on in this regard. So it's a precautionary issue, and it's not a permanent cessation of the entire program. We think that it will be cleared in a matter of days.
Thank you very much, Minister. So ENCA has indicated that they're ready. Sally, are you ready to come through? I'm going to ask SABC to please unmute. To please mute. Apologies, to please mute in the meantime. Sally at ENCA? Okay, Minister, I'm going to just check if newsroom is ready, because I had got an indication from ENCA that they were ready, but I see okay. I think I see that there's somebody trying to connect. Okay, Minister, while we wait, I do have a question from there's a question in the chat group, and I do have a question from Sophie Mugwena, SABC foreign editor. Her question is, what impact will this decision have on the vaccine rollout? And she's also asked, WHO has indicated that there is a surge of COVID-19 cases, and what's our observation here in South Africa? I think if we can maybe tackle those while we see if ENCA can come through, Minister.
The impact of this decision, we expect that it should not have any significant impact in the entire rollout, seeing that at this point we've only done 300,000 people or just under, and that in the next few days we're going to be doing another 200,000. We expect that this matter is going to be cleared in the next few days, because we expect as well that next week the first batch of 1 million vaccine should be coming through from Johnson & Johnson towards the end of the week, as was promised. So we hope that what will happen in the next few days is that a lot of information will come to the fore. For example, for us, what would be important is that is this issue seen as directly linked to the vaccine, and what aspect of that vaccine, so that we can have a sense. And secondly, is this something that is linked to any other factors, environmental factors, underlying diseases, underlying medication, and so on. Seeing that, for example, the number of people who have been affected are more female than male, is there anything that might be linked to a particular factor that needs to be understood? So those are some of the questions that we would want to get a bit more of answers from this report. We will also obviously learn more from a country that has done many more vaccines than us, and they will also be looking at the manufacturer to get guidance in terms of what is it that they are seeing, and if there's anything that the regulator, as in SAPRA, would have found in terms of the papers that were originally submitted to look at the what to expect from this particular vaccine. So we need some information, but that information can be collated pretty quickly, and therefore in a matter of a few days we should be able to move on, particularly because if you've seen how this matter has been handled in the other cases in Europe, we always balance the fact that the benefit always outweighs the disadvantages, and therefore we use that as an approach. If you look at the COVID-19 situation, the rate of thromboembolic phenomena was as high as something like 16%. So there's still a risk of thromboembolism in the case of COVID-19. So when we have to calculate the risk, we have to look at all of those issues together. The other question has been raised about the surge. At this moment, we do not have concrete information as to when the third wave might be coming. We have to continue to encourage the public to utilize, the face masks and make sure that we keep distances and sanitizers, all the non-pharmaceutical interventions. They have helped us to stay in a plateau for a while, and even through the Easter period, we have not seen a lot of activities, which is very encouraging. We will therefore believe that we must continue with these preventative measures so that we can delay as much as possible the onset of any new wave. But we haven't got any concrete information that suggests as to when exactly we could expect it, but we are quite encouraged by the fact that our people are still sticking to all of these precautions, and out of the process, these precautions are going to be able to help us to delay as much as possible any risk of a resurgence of the infection.
Thank you, Minister. Right, I'm going to see if I can help PMCA now unmute them. We may hear a bit of broadcast coming through, but that's fine.
Hi, it's Sally Burdett. Can you hear me?
Yes, we can hear you.
Fantastic. Yay. Technology is finally our friend this evening. Minister, I wanted to just get perspective on this. My understanding with AstraZeneca is that there is as yet no proven link between these blood clots, these very rare blood clots, and the dosage of the jab. Is that the same situation with the Johnson & Johnson? Are we yet to prove causality, an actual link between getting the jab and this extremely rare blood clotting situation? So that's the one part. I want to know how close we are to seeing if there is actually a link or if it's just an abundance of caution. And bearing in mind that we're due to get our first Aspen delivery of the Johnson & Johnson vaccines, I think around the 22nd. If that link is proven and there is indeed a cause for concern around a potential blood clotting disorder, rare as it may be, and the COVID vaccination, and we decide, well, actually, this is just too risky, would we be liable contractually for any payments? I'm concerned that we might have put a lot of money behind the Johnson & Johnson contract that we couldn't claw back in the event of a serious health concern.
Well, I think that you are raising a very interesting question. Towards the end of the year and early this year, we were being attacked for not having secured vaccines early enough. We actually explained that we needed to get a bit more information so that we are able to balance the risk and benefits and the success of those vaccines. We actually waited until January, and even through most of the news media, the question was, why have we left it so long? Now, today, the question is something else. Why did we move so far and secure so many vaccines so that we're now going to have a problem if those vaccines are showing any kind of side effects? Well, the reality is, firstly, we have secured the vaccines because we believe South Africans need to have an assurance that there will be enough vaccines to protect them against the COVID-19 for this year. We went for those where we thought that there was evidence to show that there was efficacy, and Johnson & Johnson was one of those. We also went for Pfizer, which was also similarly shown to be similarly effective as compared to the others. And so we have secured the vaccines as all South Africans would have expected us to. The past 2 to 3 weeks, everybody was asking us, why are things quiet about the vaccine? At least your question might raise the point that there is a need for us to always balance a lot of issues. But in this case, we have not got a link proven that the causes of the clotting disorders are directly linked to the vaccine. We also are wanting to benefit from countries that have vaccinated many more people than what South Africa has done. So we are expecting that by next week we should be getting our first batch coming from Aspen, and we hope that by that time this matter would have been cleared. And I think it's important for us to say what we are doing is just a precaution so that we can get the information so that when the public asks questions, we can give answers as such. We haven't got a single case in South Africa yet that is showing us a trend towards the clotting disorders. So we do know that our numbers are still very few to be able to show any of those, but at the same time, we don't have a case on which basis we would be saying we are then discontinuing the vaccine. Now, you have put too many postulations about what may happen if there is a link, if we have got contractual obligations, will we? Now, I don't believe that we should go as far as that in our speculation. At this moment, we're dealing with a speculation about whether there will be a link. But actually, on AstraZeneca, which appeared earlier, there has not been any direct link. There has been an association, which we still hope to learn a lot more about. We don't have AstraZeneca in this case. However, with the Johnson & Johnson, all we have done is to just take a very, early precautionary step just to make sure that we know what is happening before we proceed. And so we are not saying we've got evidence of a link. We're not saying that we've got any incidences in South Africa. We don't have. All we're saying is that FDA and in the US has taken this precaution, and because of that, we've consulted with our ethics committees. They've also said that maybe we should wait a little and get that information. We actually hope that this matter will be cleared within a very short time, and therefore the speculation about our obligation to honor the payment or the refund will not arise. And at this point, there's no basis for us to start that speculation.
Thank you very much, Minister. So we only have a few minutes left. I will try and take a couple of questions, Minister, maybe 2 or 3. Newsroom has written in with their question, and Minister has partially covered it. They're asking, are these developments going to lead to government renegotiating its liability clauses with manufacturers? I did see there was a question from Bloomberg, yes. So it's Paul, and I hope I've pronounced it correctly, Vecchiato from Bloomberg. I just need... Oh, sorry, Minister. He says that he just needs the first 2 lines of the statements. That's fine. Minister, I think that would be fine for now. Thanks, Minister.
Can I ask that we've got Professor Helen Rees, who comes from the regulator, just to make their comment, and if we could ask her to make a comment, and then yes. We'll also ask. I think for now that should be it. We will then make a comment on your question. Thank you.
Thank you, Minister. Thanks, Professor Rees. Please go ahead.
Thank you very much, and thank you, Minister. So the role of SAHPRA as a regulatory authority is to look at the safety, quality, and efficacy of all medicines in the public interest. And safety is always at the top of that list. We all know, and people have been worried about this, that we've developed these vaccines quite rapidly, and people are saying, are we sure they're safe, and how do we know? So that's why we are paying globally real attention to any safety signals at all and being very cautious. So the numbers that have been seen are 6 in about over 6 million doses given. So these are very small numbers of cases in millions of people. But what we know about vaccines is that any new vaccine, when we roll it out, we have information about safety and whether it works on tens of thousands of people. When we roll it out, it goes to millions of people. And when you roll it out to millions of people, you have to be able to not only to look for safety signals, but you also have to be able to say, is that safety signal actually to do with the vaccine? Or is it just because things happen when you roll out things to millions of people? You know, health issues do arise. And this is what's called the causality assessment. You really are looking to say, is this really associated with the vaccine, or is it just sheer chance because we're pushing this out to so many people? And that's what's being evaluated at the moment. And once we get a better idea, then we'll be able to say whether we think there is causality or there isn't. But even if there were, the other thing that we then have to really think about is what is the benefit of vaccines to individuals and to society versus risks that could be tiny. That's a discussion that we need to have, and we'll be very honest. The regulator will be extremely honest with the public and have that very honest discussion. Because if the risk is tiny and the risk of death and disease from COVID is huge, particularly for certain populations of people, that's when we make those kinds of decisions. But we will have a very full discussion once we've understood whether there is a causal link with this rare side effect or there is not.
Can I request that we ask Professor Glenda Gray to come in? Somebody's asking when are the Johnson & Johnson results coming through? Thank you very much.
Good evening, fellow South Africans, the Minister and Helen, and the DG or protocol observed. So we have vaccinated just over 290,000 healthcare workers in South Africa. We haven't seen any of these rare side effects, these rare thromboembolic side effects with thrombocytopenia. I think it's important to note that we need to continue to observe. Safety of our participants are important, and anyone who presents with a thromboembolic event in our study, we will investigate. We'll be looking for thrombocytopenia. We'll be looking for antibodies to the platelet factor 4, and to try and see whether we can see the same thing. It's important to note that we have seen these rare thrombotic events in other vaccines, the J&J, the Pfizer, and the Moderna, as well as the AstraZeneca. So these events have occurred. We're trying to establish whether the incidence of these rare thrombotic events are the same or different in the various vaccines. So that data is ongoing. We're also looking to see whether what is the incidence of these rare thromboembolic events in the general population, to establish whether there's an increased incidence, particularly amongst women in under 38 years of age. So we need to continue to monitor this. Safety is important, and so when we move forward, we will obviously investigate participants and be cautious and continue to report our safety data to the SAPRA, where we are meeting to discuss these further. We do hope that we will be able to continue vaccination after the pause, and that we will be able to continue vaccinating healthcare workers. Healthcare workers do require vaccination, and hopefully we'll be able to continue the program once we've established the concerns that the FDA have.
Ngiyabonga kakhulu Dr. Manzi, ngiyafisa ukudlulisa ukuthi sithole umbiko ovela eMelika othi ikomiti elibhekelele ukuphepha kwemithi lithatha isinqumo sokuthi umgomo lo obhekene neJohnson & Johnson make umiswe insukwana ngoba kutholakale kunabantu ababe nesifo sokuba namahlule egazini emzimbeni wabo. Ngaleyo ndlela ke sitholile ukuthi labo bantu bancane kakhulu, kodwa ngokucophelela esifisa ukuba sikwenze uma sisebenzisa uhlelo lokugoma, sithe nathi soke sime kancane bese sithumela bonke ososayensi bethu izingcweti zonke zike ziyobheka ukuthi kwenze njani, isukaphi lento, ukuze nathi sibe nesiqiniseko sokuthi uma siqhubeka nohlelo lokugoma akukho ngozi esiyibonayo. Kodwa ngokohlelo lwethu eNingizimu Afrika, abantu esibajovile ngalomgomo bangaphansi kwa-300,000, so akukho muntu kubona okhombisa ukuthi kunenkinga ehambisana nalento ebikwe eMelika. Kodwa siyabona ukuthi eMelika bese bejove abantu abangaphezulu kwezigidi eziyisithupha, 6 million, kodwa masibuka nenani leli elibalwayo alilikhulu kakhulu ukuthi ngaze kuthiwe sekuyinengozi enkulu kangako. Kodwa-ke ngokucophelela sifuna ukuba kwenzeke, sithe kube nesiqiniseko sokuthi namuhla ebusuku ikomiti elibhekelela ukuphepha kwemithi eNingizimu Afrika izohlangana libukisana ukuthi yini efuna ukwenziwa, bese kuthi ikomiti eleluleka ungqongqoshe ngohlangothi lokuphepha kwesimo sokulwa nesifo se-COVID nalo lizohlangana futhi. Sesihlanganele nalamakomiti okuyiwona abhekelele ukuhleleka ukuhleleka kwenhlelo zokucwaninga wama-studies esiwabiza ngama-ethics committee. Base bethi nabasime kancane sibone ukuthi kwenzekani, kodwa sicabanga kuzoba iy'nsukwana ezimbalwa nje lokhu bese sithola lonke iqiniso. Sisazimisela ukuqhubeka nokuthi kuqhubeka uhlelo lomgomo. Ngesonto elizayo kuzobe kufika isigidi semigomo ezobe ifanele isetshenziswe izwe lonke. Sicabanga ukuthi kofika lolo suku sesikwazi ukuthola lonke iqiniso. Ngakho sithi masingaphazamiseki emoyeni, sizothola nje iqiniso bese siyaqhubeka. Kodwa hayi ngoba kukuthi khona sekusikhathaza kangako eNingizimu Afrika ukuhambisana nje nesimo esisithola esivela kwamanye amazwe ukuthi uma kukhona abakusolayo sikubhekisise singakaqhubeki kakhulu. Siyafisa ukudlulisa nje lokho ukuthi akuyona into esesithi siyakumisa uhlelo lokugoma, uhlelo nje lokubhekisisa ukuthi kwenzekani bese siyaqhubeka uma kucaca ukuthi akho into ehlanganisa ukugoma nalezi zifo ezitholakele. Ngiyabonga.
Siyabonga kakhulu Khabazela, sibonga kakhulu futhi na kuba bonke ababukela basekhaya ngokwazi ukuthi bazwe lo mlayezo esibathulele wona. Khabazela, ngicela ukubheka ukuthi uKhabazela useqedile sesingakwazi ukuthi sivale.
We have all the questions. There will not be a renegotiation of the contracts because there is no need yet. We are saying that there's no causal link identified, and therefore we will continue on the basis of what we've got at this moment. Thank you very much.
Well, thank you very much, then, Minister, and a huge appreciation to our media partners, the broadcasters, the senior officials, experts, Deputy Minister, DG, or Protocol Observed, everybody for joining us. Really appreciate you being so enthusiastic about communicating on these very, very important developments that are of great public interest. And with that, we will now close this press briefing. Thank you very much for joining us. Have a good evening.